Hello and welcome to Pregnancy Info. Today we will tell you all about implantation bleeding, its causes, symptoms, and treatment. Implantation bleeding is an early sign of pregnancy that occurs when a fertilized egg, mean embryo, implants into the wall of a person's uterus. It can cause light bleeding that lasts up to 2 days. Implantation bleeding is considered a normal part of pregnancy. What is implantation bleeding? Implantation bleeding occurs when a fertilized egg implants into the lining of your uterus or endometrium during conception. After sperm fertilize the egg, it's called an embryo. The embryo travels down the fallopian tubes into your uterus. At this point in your menstrual cycle, the endometrium is thick and vascular. This makes it an ideal spot for the developing embryo to attach and grow. Implantation can disrupt the blood vessels in the lining of your uterus. This is the blood you see during your implantation bleeding. Not everyone will experience implantation bleeding. It's considered a normal part of the pregnancy and it is not usually a cause for concern. Implantation bleeding is often confused with your menstrual periods. It can happen when your period would have been due to arrive. The exact time varies, but most implantation bleeding occurs about 6 to 12 days after the egg is fertilized. In most cases, people have not taken a pregnancy test yet and don't know they are pregnant. How common is implantation bleeding? About 25% of pregnant people will experience implantation bleeding. It's considered a normal part of pregnancy. Quantity. Implantation bleeding is very light. This is called spotting. Some people will have implantation bleeding over the course of a few days while others will only bleed once. Most of the time you will see it as a spot in your underwear or in toilet paper while wiping. Heavy bleeding isn't typically for implantation bleeding and could be a sign of an underlying issue. Possible causes. Implantation occurs when a fertilized egg attaches to the inner lining of the uterus. Your uterine lining is filled with blood vessels and vascular tissue. As the embryo embeds into that lining, light bleeding can occur. Think of a little animal digging around in the dirt to find a cozy place to sleep. The animal will burrow and dig into the ground so much that dirt will get displaced. When implantation bleeding occurs, the lining of your uterus is like dirt and your embryo is like a small animal trying to get comfy. Once implantation is complete, the pregnancy continues to develop and your uterus begins to produce a hormone called human chorionic gonadotropin. This hormone is responsible for keeping the uterine lining thick and it gives you a positive pregnancy test. What are the symptoms of implantation bleeding? Implantation bleeding is often one of the first signs of pregnancy. The main symptom is light bleeding or spotting that lasts a day or two. Sometimes it's accompanied by other early pregnancy symptoms such as headache, breast tenderness, bloating or nausea, feeling tired, etc. What does implantation bleeding looks like? Implantation bleeding is brown, dark brown or slightly pink. It's considered spotting or light bleeding. It should be heavy enough to soak through a pad. Implantation bleeding resembles the flow of vaginal discharge more than it resembles the flow of your period. If your blood is bright red or contains clots, it might indicate your menstrual period or another issue. Duration. Implantation bleeding can last a few hours or a few days. The length of time you have implantation bleeding varies. It's rare for it to last more than 3 days. Implantation bleeding versus periods. There are several differences between period blood and implantation bleeding. Number 1. Implantation bleeding lasts up to 48 hours. Otherwise, periods last up to 1 week. Implantation bleeding is light or spotty and does not get heavy or clot. While period bleeding starts heavy before getting light, blood can contain clots. Implantation bleeding is light enough for a panty liner, while period bleeding soaks several pads per day. Implantation bleeding blood is brown, dark brown or has a tinge of pink. Otherwise, period bleeding is bright red, pink or brown. Implantation bleeding vary mild if any cramping, it feels less intense than period cramps, while periods cramping occurs 1 or 2 days before bleeding starts. Treatment or care. There is no treatment to stop or decrease implantation bleeding since it goes away on its own in a healthy pregnancy. In most cases, wearing a panty liner in your underwear is all you will need. If your bleeding is soaking through a pad, it's probably not implantation bleeding. So this is all about the causes, symptoms, signs and treatment of implantation bleeding. Hope you have feel the video useful. Must share it with your friends and family members to acknowledge them about implantation bleeding and what is periods. Thank you.